Hi, I just wanted to show you this bit. This is Piers Morgan, and he's having a conversation with Sarah Hewson, who is the head of Kensington Palace crew. She keeps the media in check. She makes sure that they read the script, that they say only the things that have been allowed by Kensington Palace to be said about Kate, William, and the kids. And she got mad at Piers because he went off script. He was alleging that something else is going on behind the walls at Kensington Palace. He mentioned, I think, once that he thought maybe that Kate was dead or something. I mean, he was hitting like the rumor mill, and she was pissed. So now she's coming here and she's going to clean up this mess, and she's straightening Piers out. She is laying out the written script that he was supposed to say in the first place. He was not supposed to give these extra added personal thoughts. So I'll tell you, the British media is too much. So here he goes. He's going to introduce her.
The Royal Editor for Talk TV. Sarah, a very busy night for you, I think, from now on. But let's just talk about this remarkable statement. We got wind of it about an hour before it happened, that it was being released, I think, initially to the BBC. I was watching it live when it happened, and there was Kate, there was Catherine, the Princess of Wales, in a garden setting on a bench, speaking directly to the world in a way that I've never seen it before do this, or in fact, I can't remember many royals ever doing this, and being remarkably candid about what's been going on.
Yes, and this was a video that was filmed on Wednesday, Piers. I understand it was done in one take. The Princess of Wales speaking directly to camera and addressing the public and giving the details of her diagnosis, which, as she said, has come as a huge shock to them. She talked about...
Now, if you saw that with Kate, where she was sitting on the bench by herself, that looked like she was in a studio. That bench was probably in a room. The background looked like it was either a picture behind her or something on the wall that was flashed, or it could have been through some type of technology. But I don't think she was really outside. I think she was sitting in a room where that was done.
What an incredibly tough few months it has been for her and the whole family. And she described the main focus for her and William, which has been about protecting their children, George, Charlotte and Louis. And the reason why this video was released tonight is because the children broke up from school earlier on this afternoon for their Easter holidays, and William and Kate decided that they could then make this public in the knowledge that they could shield their children from it. They've explained it to them in the best way that they can, in the most appropriate way, given their young ages. Catherine said how she has told them, I'm well, I'm going to be okay, and that she has reassured the children. And I think this statement really summed up what this family is all about for them, which is protecting those children. And Piers, we've talked about that over the past few weeks and months.
Now, she's not giving him a chance to say anything. She is giving off the script. He wants to say something because he normally interrupts everybody. He doesn't let anybody come on and just plow through with their prepared speech. But he knows he needs to shut up. This woman is in charge, and he is not supposed to interject anything. And he is biting his tongue. But you can see, watch him as it goes on, his face gets redder.
That those three children are everything, and every decision that is made by William and Kate is about putting those children first, and this is exactly that.
What it will do, of course, it will hopefully put a stop to the absolute tsunami of increasingly crazy conspiracy theories. And, you know, I was reminded tonight that some of the American talk show hosts in particular have been, in the last few weeks, openly mocking the Waleses over their marriage, for example. That now looks particularly distasteful in light of what we know they've been going through.
I think there will be some people feeling mightily ashamed for the way in which they have approached this over the past few weeks in particular.
Now, people shouldn't feel ashamed. The palace did that by lying so many times. If had they just come out with the truth, said she has prolonged illness, she's going to be out for probably a year, that it was just like they did with Charles, it is a form of cancer, but they thought they caught it. They're not going to discuss the type and so forth. They don't need to say everything, but if you let people know but when you start lying, you put out fake pictures and everything, people are going to put the puzzle pieces together, and when they don't fit, then of course they're going to try to fill in the holes. So that was totally the palace's fault. It was not the fault of the people who were trying to fill in the holes and make sense of what they were hearing and seeing.
Particular Piers, with that feverish speculation about where is Kate, and she's explained it very clearly in this. While not directly acknowledging the conspiracy theories, she's made it very clear that it has taken her time. She needed time, firstly, to recover physically from the abdominal surgery in order for her to be in a state to start the preventative chemotherapy, which she now began at the end.
Now, preventative chemotherapy is crazy. There is no such thing as preventative chemotherapy. When you have a tumor, they take it out, and then they find out you have cancer. You have cancer. You can't prevent the cancer. You already have the cancer, and they want to know if the cancer has spread. If it has spread, you still have the cancer, and they need to give the chemotherapy to kill the cancer cells. It's a treatment, not prevention. So this whole thing of preventative chemotherapy is a lie. It's a confusion of words, playing with words, because they want to make you think that her risks are very, very low. In fact, a good number of women, I'd say about, I don't know, don't have the figures in front of me. I'd say 20% and more might have metastases and go on to have further problems. And of course some die. But we don't want to think about that with Kate, but it is a part of the realistic picture. But this whole thing of saying preventative chemotherapy doesn't make any sense, and it shows it was done by the palace and not by anyone who has any medical sense.
Of February, but also to be able to process this emotionally. She talked about what a shock it had been. She talked about the comfort of having William by her side. Again, speculation about the state of their marriage.
And of course, William was not by her side. She was on that bench alone, delivering this message. And I think it would have been nice for William to be there, but of course that's her choice. She doesn't have to have him there if she doesn't want him there.
Well, very, very clear that this has been a couple who have been very, very closely united on this. Also, those questions over Prince William's absence from his godfather's memorial service. We now know that it was that day when Kate received her cancer diagnosis, shortly before William was due to leave.
And that's in doubt, because normally after the tumor's out, they will immediately start processing the tissue to make it ready for staining, and then take it in for evaluation, and that's when they'll find the cancer cells. And that normally doesn't take a very long time. So, it'll take days to a week or so, but we are far beyond that. And so that whole thing about William getting the first mention that she has cancer at the time when he bowed out of his godfather's funeral, it doesn't really make sense. That sounds like another lie, but here she is with the story.
For that memorial service, and that is why he pulled out of that event and cited personal matters, and that is why it was such a last-minute decision. Now, at the time, Kensington Palace had said that Kate was continuing to recover well, and it wasn't clear whether that decision was made because of Kate. We We now know the truth of that it was all about being with his wife, and entirely the right and entirely an understandable decision to want to support his wife, and also to deal with his own shock as the news. As you said, this double news for him, his father and his wife, both now suffering from cancer.
Could they have handled this any differently? I mean, it's been a crazy few weeks. I can't remember anything quite like this since the days when Diana was alive. And it's really a signal of just how big a star in the royal firmament Kate is, and how important.
Now that's important. They want to cast Kate not as a part of a royalty. They want her to be a star. So they're still trying to compare her to Meghan, who's in Hollywood, who has what you would call star quality. She had a TV show. She's out there mixing with people who are known as stars, and so they want Kate to be a star. Kate's not a star. Kate is a princess, and that's about it.
She is to the royal family and to the brand of the royal family, and indeed the monarchy. But some people may say, well, could they have said something a bit earlier to quash all the conspiracy theories? We've had the video, of course, of them at a farm shop. We had the picture taken by paparazzi of her.
There is still question whether or not that was Kate at the farm shop. It didn't look like Kate to me. It didn't look like Kate's walk. It didn't look like Kate's face. We all know that every member of the royal family has a double, and the doppelgangers. So who that girl was, maybe it was Kate, didn't look like Kate. And then, of course, her swinging a bag of stuff that she bought while William had a bag of stuff didn't make any sense. So that might be part of the lies that the Kensington Palace put out.
Car, going to school with her mother, and so on. Should they have said something earlier, or do you think that given what we now know about what they've been going through, and in particular what she said about the kids and wanting them, quite obviously, I mean, I'm a father of 4 kids, I would want mine to be the absolute priority in a situation like this. Do you think that this has been really what's been going on behind the scenes the entire time?
I don't think anyone can question their decision making now, when Catherine has set it out so clearly that the reason why this news has been announced now was because they wanted to protect their children. They had to tell them in their own time. They needed to give them space and time to process it.
Of course, the whole time Kensington Palace and Buckingham Palace have been putting out stories against Meghan and Harry, and they also have children, and no one has protected Meghan and Harry and her children. They deserve the same right to be held with some respect by these outsiders, but they give no respect to Harry and Meghan and their children and what their children are going to face in school by these rumors put out by these castle workers. But here they'll talk about how you have to protect the royal kids from something that's very common, really, in London, cancer. And I read one statistic that says 1 out of every 2 people in London will come face to face with some form of cancer in their lifetime. So they need to acknowledge that cancer is a problem in London, and it shouldn't be hidden to make the people who get the cancer feel like they're, sneaking around the hallways and can't talk about their illness. Kate is supposed to be a leader. She's supposed to be a leader in the royal family for women, and I think this image of her sneaking around about her cancer is very bad. She has met previously with cancer patients. She has given them messages that they should hang in there and get the strength. But Kate needs to do the same thing. She needs to show how when you get that diagnosis of cancer, you're going to be strong. You're going to do things to help yourself. You're going to help other people who are going through the same thing, and try to educate people about cancer, about the need for more research, and she needs to let people know what kind of cancer she has, first of all, because there are a lot of things in the abdomen, and we're just guessing that it's bowel cancer. So.
And they wanted to do it when they could protect the children and I guess preserve them in their own little bubble, away from school, away from the questions that they might be asked, that they wouldn't be there to give the answers to. And very clearly they've thought long and hard about how they've communicated this to the children.
The funny thing about kids, they're very resilient, and more than likely they're not going to think of their mother's death, and they probably couldn't even really picture their mother dying. And after they get the news, it'll probably be a couple of minutes, and they'll be off skipping around the castle and playing games and doing other things. It's only if those two, William and Kate, are sitting around crying and boo-hooing all the time, that the kids will get stressed out. But normally, kids are very resilient, and they'll move on, and they'll take it much better. Mention it occasionally, but they'll take it much better than the adults.
I mean, little Louis, just 5 years old, George, 10 years old, they're not old at all. My children are very similar age, and I can only begin.
Me. No one asked about what her kids were or what her kids would think. We don't know her. We don't want to know anything about her kids, but she has to drag this whole situation of William and Kate to her and her kids. Why in the world would she do that? Me. Can't she talk about somebody else without trying to put herself in the position of the princess?
To imagine how difficult it has been for them to give the children that news and not to frighten them, to want to reassure them. As Catherine said, I told them I'm doing well and I'm going to be okay. And I think knowing that, we can understand now why they were so desperate to protect themselves, to preserve their privacy.
Yeah.
But also, let's not forget, they didn't know this. She had abdominal surgery on the 16th of January, and at the time, before the surgery, the tests had not shown any signs of cancer. She then went in for major abdominal surgery, and it was the post-operative tests that detected there had been cancer there. And so they've had a double whammy again here with that first news that she needed surgery, and then to find out, much to their shock, that actually